Murarka, who's managing director at DFJ, Ingrid Vanderbilt from Bell, and David Hornik, who was supposed to be here, is watching on the live stream. He has a sick child. He's going to be tweeting questions, I understand. And Charles Hudson, partner at SoftTech VC. So who would like to start with the questions? And why don't you?
I was just curious, how did you validate the accuracy of your algorithms and all the data behind the analytics?
Yeah, so we've gotten a data set, and we're in the process of releasing a data set from Johns Hopkins. It's one of the largest hard sound data sets. And the gold standard in the industry right now is the echocardiogram, where they can actually visualize a patient's heart sound. Obviously, it's expensive, and not everyone can do that. But there's this data set that has been gold standard tested against. And so we can compare against that and then determine the accuracy based on that.
Coming from a family of doctors, I think doctors and entrepreneurs, I think this is pretty exciting. And what I'd love to understand is, how are you thinking through your business model? Who are you actually selling this to?
Yeah, that's a great question. We see one of our biggest customers being hospital systems, the large hospital systems, who really need to focus on reducing their internal cardiology referral rate. As all medicine moves towards a pay-per-performance type of schema, it's going to put a lot more pressure on doctors to not unnecessarily refer people to a cardiologist. So if we can help primary care physicians better make those screening decisions and determine, does this patient need to see a cardiologist or does this one not need to, we can then end up providing better outcomes and lowering costs for the hospital system and for the insurance companies.
Do you have any channels established for the actual sales? Because I agree with Ingrid that the go-to-market seems to be probably the challenge. I really love the insight of the data play and adding a sensor to a phone. I think in general those are really interesting trends to be betting on, but the go-to-market in medical tech has traditionally been very tough.
Yeah, one of the partnerships that we're building right now is with an electronic medical records company that does smartphone-based electronic medical records. And so those are our ideal customers, the same type of people who are, the same physicians who are really advanced, looking forward to mobile technologies for their hospitals, but also be likely interested in our technology as well.
What about just going straight to the insurance companies? What are you thinking about that?
What we've seen is that there's a lot of reluctance from hospitals to purchase things if they're recommended by the insurance companies. Generally, those seem to be things that are only cost savings focused and not necessarily outcomes focused, and hospitals want to focus on better outcomes.
Actually, if we have more time, I have more questions.
Yes, sure.
Oh, good. So what did you do before this? So what's going to give us confidence that you can actually pull this thing off?
Yeah, that's a good question. Before this, I studied bioengineering at UC Berkeley, and I'm actually a graduate student there in bioengineering as well. And I had significant background in software development. I've done iOS apps, mobile apps, and web applications. And I just really saw this opportunity to combine my academic background with bioengineering with my skill of software development, put those two things together.
Can you tell us a bit more how you handle the patient privacy data aspect of your solution?
Yeah, that's a great question. So we built our entire web application, all of our backend, to be HIPAA compliant. HIPAA is the federal regulation that controls how you protect patient health information. And obviously, we want to make sure that's protected. And then every interaction we have with a physician has to go through an authentication screen. We can verify who has looked at any heart sound, and we really have taken security from the ground up with all our software.
So we have a question from David Hornik. He says, he's curious how big the stethoscope market is, and any way to do this without just a smartphone and no device.
We thought about doing it without any hardware at all, but just realized that with these really sensitive heart sounds, we need to have some sort of hardware component to pick those up accurately. We tried to, in the beginning, could we record them with just the iPhone microphone, and it just wasn't possible without a dedicated hardware component. In terms of the stethoscope industry itself, it's a $300 million global industry, but that's just for the hardware components. And we're looking at a SaaS type of model where we would charge a monthly fee to access our analytics and algorithms.
Okay, well, thank you. Big round of applause for Eko.